cardiomyopathy is the measurable deterioration of the function of the myocardium for any reason, usually leading to heart failure. Common symptoms are dyspnea and peripheral edema. People with cardiomyopathy are often at risk of dangerous forms of irregular heartbeat and sudden cardiac death. The most common form of cardiomyopathy is dilated cardiomyopathy. Classification: although in theory the term cardiomyopathy could apply to almost any disease affecting the heart, in practice it is usually reserved for severe myocardial disease leading to heart failure. An extrinsic cardiomyopathy is a cardiomyopathy where the primary pathology is outside the myocardium itself. Most cardiomyopathies are extrinsic. By far the most common cause of an extrinsic cardiomyopathy is ischemia. Ischemia can be understood as poor oxygen supply of the heart muscle. The World Health Organization calls these specific cardiomyopathies. An intrinsic cardiomyopathy is defined as weakness in the muscle of the heart not due to an identifiable external cause. This definition was used to categorize previously idiopathic cardiomyopathies, although specific external causes have since been identified for many. For example, alcoholism has been identified as a cause for some forms of dilated cardiomyopathy. To make a diagnosis of an intrinsic cardiomyopathy, significant coronary artery disease should be ruled out first. The term intrinsic cardiomyopathy does not describe the specific etiology of weakened heart muscle. The intrinsic cardiomyopathies consist of a variety of disease states, each with their own causes. Many intrinsic cardiomyopathies now have identifiable external causes including drug and alcohol toxicity, certain infections, and various genetic and idiopathic causes. For example, mutations in the cardiac measurable genes as well as in the DES gene might cause arrhythmogenic right ventricular cardiomyopathy. It is also possible to classify cardiomyopathies functionally, as involving dilation, hypertrophy, or restriction. Types: primary intrinsic cardiomyopathies, genetic, hypertrophic cardiomyopathy, arrhythmogenic right ventricular cardiomyopathy, isolated ventricular non-compaction, mitochondrial myopathy. Mixed, dilated cardiomyopathy, restrictive cardiomyopathy. Acquired, peripartum cardiomyopathy, Takotsubo cardiomyopathy, loeffler endocarditis. Secondary extrinsic cardiomyopathies, metabolic storage, amyloidosis, hemochromatosis. Inflammatory, viral myocarditis, Chagas disease. Endocrine, diabetic cardiomyopathy, hypothyroidism, acromegaly. Toxicity, chemotherapy, alcoholic cardiomyopathy. Neuromuscular, muscular dystrophy. Nutritional diseases, obesity-associated cardiomyopathy. Other, ischemic cardiomyopathy is a weakness in the muscle of the heart due to inadequate oxygen delivery to the myocardium, with coronary artery disease being the most common cause. Not supported by current cardiomyopathies classification schemes. Signs and symptoms. Symptoms and signs may mimic those of almost any form of heart disease. Chest pain is common. Mild myocarditis or cardiomyopathy is frequently asymptomatic. Severe cases are associated with heart failure, arrhythmias, and systemic embolization. Manifestations of the underlying disease may be prominent. Most patients with biopsy-proven myocarditis report a recent viral prodrome preceding cardiovascular symptoms. ECG abnormalities are often present, although the changes are frequently non-specific. A pattern characteristic of left ventricular hypertrophy may be present. Flat or inverted T waves are most common, often with low-voltage QRS complexes. Intraventricular conduction defects and bundle branch block, especially left bundle branch block, are also common. An echocardiogram is useful to detect wall motion abnormalities or a pericardial effusion. Chest radiographs can be normal or can show evidence of congestive heart failure with pulmonary edema or cardiomegaly. Images. Treatment. Treatment depends on the type of cardiomyopathy and condition of disease, but may include medication or iatrogenic implanted pacemakers for slow heart rates, defibrillators for those prone to fatal heart rhythms, ventricular assist devices for severe heart failure, or ablation for recurring arrhythmias that cannot be eliminated by medication or cardioversion. The goal of treatment is often symptom relief, and some patients may eventually require a heart transplant. Treatment of cardiomyopathy using alternative methods such as stem cell therapy is commercially available but is not supported by convincing evidence. References. External links: Cardiomyopathy at DMOZ, Cardiomyopathy information for parents. 1. The CMA official website, information on cardiomyopathy for everyone.